Well, thank you. Thank you for having me invited for this short presentation. My name is Joannes Hallegraeff. I am a researcher for low back pain and for nocturnal leg cramps that are my main issues in research. And I want to tell you in a short presentation about our recent trial we have published in 2019, which was directed to the effectiveness of a pre-sleep stretching regimen in frailty older adults aged over 75 years. As you can see at the first slide, this is the poster dia, and the conclusion is stated here: a 6-week stretching regimen is likely to reduce the frequency and pain intensity of NLC, nocturnal leg cramps, in frail older adults aged over 75 years. So let me explain what we are talking about. Nocturnal leg cramps. First, we have to subgrouping muscle cramps in 4. The first one is the most known subgroup, and that is an exercise-associated muscle cramps. We also recognize football players or sporters in additional time attacking, suddenly cramping, and have following that a lot of physical problems. That is one subgroup as known as exercise-associated muscle cramps. The second group is iatrogenic cramps caused by medication use. Medication use, for instance, diuretics, have a lot of influence on cramping, muscular cramping, as a side effect. The third group is cramps secondary to diseases, and there are a lot of diseases associated with muscle cramps. For instance, heart and vascular diseases like hypertension, varicose veins, ankle edema, coronary artery diseases, etc. The second one is kidney diseases or renal problems. The third one is musculoskeletal disorders like arthritis or myopathies. The fourth one is neurological, a lot of neurological diseases like neuropathies, motor neuron diseases, radiculopathy, neuromuscular or neurological diseases, peripheral neuropathy, etc. And the last one I want to mention is metabolic disorders. And perhaps the most known metabolic disorder is diabetes mellitus. So there are a lot of diseases who are associated with nocturnal leg cramps. There is no causal relationship, but only a correlation, no causal relation. So the last subgroup, and that's the most important where we are talking about, is all muscle cramps occur in rest. And we have two main cramping features of that: pregnancy-related cramps and nocturnal leg cramps. And nocturnal leg cramps do occur in older adults, is increasing with age, and is also increasing with comorbidity. And as I said, just a lot of specific diseases are correlated with cramping. So nocturnal leg cramps is increasing with age. Well, how can we diagnose nocturnal leg cramps? There is no validated instrument, no validated test. So we must recognize diagnosing from history taking and clinical cues of older adults. And in our systematic review published in 2017, we identified 6 main issues, main clinical issues, clinical cues from nocturnal leg cramps in older adults. Those are intense pain. Pain is very intense, varying from seconds to maximum 10 minutes. Pain is always in calf or foot, seldom in the thigh. Pain is always persisting after cramping had occurred. So after attacking nocturnal leg cramps, pain will be persisting. Due to that, the sleep is disrupted. The sleep quality has decreased night after night. And following that, distress during day, fatigue is a common problem in these participants. So keeping that in mind, we must know that 2 other closely related musculoskeletal disorders also occurring in the legs are closely related with nocturnal leg cramps and often confused with nocturnal leg cramps. We speak about restless leg syndrome and periodic limb movement disorder. Restless leg syndrome is featured as an uncomfortable and unpleasant sensation in the legs associated with an urge to move. Relief of that symptoms is by moving the legs. Sensations in foot or arms can occur also and always occur during rest, in the evening or at night. PLMD, periodic limb movement disorder, is less prevalent in contrast to restless leg syndrome. It's also highly prevalent, but its idiopathic PLMD disorder is a repetitive jerking movement disorder of the leg and in a period of approximately 20 to 30 seconds. Also during sleep, but also may occur during wakefulness and complaints during wakefulness. During wakefulness, it's more intense than during night. So in literature or in research, but I think also in clinic, NLC will often be confused with RLS or PLMD. What's the therapy of NLC? The most common therapy intervention is the use of medication, quinine or hydroquinine, natrium, kalium, vitamin BE are often applied, and well, there is a lot of discussion about these medication. There is also conflicting evidence about their effectiveness in NLC, but most of all, many side effects occur. So hypertension, hepatitis, tinnitus are known side effects of this ongoing use of this medication. So in 2012, we ask ourselves whether a physical intervention program, like a pre-sleep stretching program, might be effective in these older adults to decrease frequency and pain intensity of NLC. We analyzed a group of older adults over 55 years and saw an effectiveness as well as in frequency as well as in pain. So we want to study whether the same stretching program would be effective in a frailty older adults population aged over 75 years. And that was the main issue of our study from 2019. It was a pilot randomized trial, and within 29 participants, 15 in the experimental, 14 in the control group, inclusion criteria aged over 75, and all participants had to be NLC at least once a week. And they must score greater than 1 on the Groningen Frailty Indicator to be analyzed as frailty. The stretching protocol is simple. 3 stretching techniques. The triceps surae in the calf, the hamstrings, and stretching both triceps surae and the hamstrings together. 3 exercises for both legs. Each stretch must be held for 20 seconds and must be performed 3 times with a short interval for rest and then again. The results of the study was that as well as in frequency, as well as in pain intensity, a significant decrease occurred. A significant decrease was analyzed in the experimental group as opposite to the control group. You see in the difference between the groups, experimental minus the control was minus 0.9. And for the frequency and the pain intensity was scored from 0 to 10 on the NPRS scale was minus 0.7. In addition to that statistical analysis, we analyzed also, we calculated also a paired sample t-test with a t-score of 2.2 with significance. The conclusion of the study was: be aware of serious pathology when recognizing patients with cramping in the lower limbs. In addition to serious pathology, we have seen a lot of diseases are associated with cramps, but whether the cramps are of a non-specific character, we can apply a stretching regimen. So be aware of that. In addition to that, we must differentiate NLC from RLS and PLMD, often confused in literature, but also in clinical practice. So be aware of that difference between these 3 disorders. Because a stretching program applied before sleep is effective, it is safe, and has no side effects. And we saw the study that also older adults aged over 75 were capable to perform the stretches. So a physiotherapy consult might be useful, but in addition to a physiotherapy consult, home care nurses, physiotherapists, and perhaps also a geriatric doctor will initiate a multidisciplinary collaboration and a multidisciplinary treatment. So it is an important issue to apply such as an easy way of treatment of NLC, but also for the patients itself. It's an active treatment. Self-efficacy will increase. Patients are aware of what they are doing, and our experience is how older the patient is, they also want to continue these simple exercises. No problem to do that. So, we return to the first slide, the poster. I hope I have explained our conclusion, and I think it's an important message for home care nursing, nursing in general, but also for doctors and physiotherapists also working with older people, older adults, home dwelling, community dwelling adults with this musculoskeletal disorder. Thank you for your kindness for inviting me.
Well, thank you for presenting. This is very good. You know, that there's something so easy that they can do and without side effects. So does anyone else have any questions?